All right, these notes are going to go into your PBS course file. These are our notes for diabetes. Normally, food is broken down into glucose. That sugar travels in the bloodstream, and insulin opens the cells so that sugar can enter the cell to be used to create ATP, which is our cellular energy, or to be stored. We have two types of diabetes that we're going to look at, type 1 diabetes and type 2 diabetes. Of the people who are diabetic, 5% have type 1 diabetes. This is usually early onset. These people produce no insulin. The link to what causes type 1 diabetes is still under question. It's still not for sure, but there are links to illnesses, genetics, and autoimmune system issues. The other 95% of people who have diabetes have type 2 diabetes. These individuals will produce insulin, but the insulin is ineffective, or there is not enough insulin, or the cells are insulin resistant. Type 2 diabetes is linked to family history, age, weight, and ethnicity. When we talk about diabetes, we focus on two different aspects, high blood sugar and low blood sugar. So this section of the page is for hyperglycemia. Hyperglycemia, glucose, so this means high blood sugar. So people who are undergoing or having the symptoms of high blood sugar, they're going to show symptoms of being thirsty, having frequent urination, feeling hungry, having blurred vision, and having infections that are slow to heal. People with hyperglycemia have an increased risk of heart disease, stroke, neuropathy, kidney failure or kidney disease, high blood pressure, and ketoacidosis. And we'll talk about that a little bit more in class, but ketoacidosis, when ketones break down from fat. Ketones are produced from the breakdown of fat. There we go, that's what I wanted to say. All right, when you have too much sugar in the blood, the red blood cells' water potential is higher than the water potential of the blood. So these are all my little red blood cells. Because the red blood cells' water potential is higher than that of the blood, the water leaves the red blood cells, and those red blood cells are going to shrivel up. So the red blood cell is hypotonic. The blood itself, the serum of the blood, is hypertonic. So water is going to move from where there's more water to where there's less water. Because there's lots of solute, in this case sugar, the blood water potential is less than the red blood cell's water potential. All right, next, hypoglycemia. Hypo means that we have low blood sugar. Now, we can experience hyperglycemia and hypoglycemia even if we don't have diabetes, but our body is going to revert to homeostasis and get things back to normal. So, low blood sugar, this could be due to medications, to meds. If you skip meals, you're going to have low blood sugar. If you're a diabetic and you inject too much insulin, you're going to have low blood sugar. A high amount of activity or exercise, you're going to be burning through that glucose to create the energy to use your muscles, so that's going to cause low blood sugar. The symptoms of hypoglycemia: shaky, sweaty, dizzy, weak, pass out. When diabetics get sick, they produce hormones that trigger the immune system, but those hormones also counter the effect of insulin. So diabetics, when they get sick, they have to be very careful that their blood sugar doesn't get too low. Then there are a couple of tests that are associated with diabetes: the GTT test, the IT test, and the hemoglobin A1C. The GTT test is a glucose tolerance test. It is a test to determine how the body utilizes glucose. This answers the question, is the patient diabetic? The IT test is an insulin test. It determines the insulin production of the person. This test will answer the question, what type of diabetes does the patient have? The hemoglobin A1C test is used to track how well a patient is controlling their blood sugar for the past 2 to 3 months, which is about the lifespan of a red blood cell. You want your hemoglobin A1C numbers to be under 6. Glucose binds to hemoglobin. Short periods of hyperglycemia don't majorly affect the red blood cells, but the longer your blood sugar is high, the more glucose binds to the red blood cells, and that will increase your A1C number.